I'm so happy to welcome back my favorite pediatrician, and that's a high bar because I love so many pediatricians. They're among my favorite people in the world. But Dr. Lauren Crosby is here to give us an update on all our COVID questions and concerns, because babies and children always come with questions and concerns, but never more so than now. Welcome, Dr. Crosby.
Thank you so much, Heidi.
Thanks for being here. We got a ton of questions from our moms and probably our dads too. And the first one is one that we talked about the very first time we talked about COVID. And at that point, neither one of us was super concerned, but this mom asked, I'm worried that quarantine and social distancing could have lasting effects on my baby's social and emotional development. My little one has only seen a handful of faces since being born and still has yet to meet her close family, including her grandmother. Oh, that's so hard. And with separation anxiety, I'm sure she's worried about stranger danger approaching soon. I'm starting to wonder how this will impact her. What do you think?
I think it's a good question. I think it's more the anxiety of the parent in this case, though, because if the baby's seen a handful of faces, that's plenty for a little one.
Yeah.
They really just need their parents' faces, really. So if they're talking to them all the time and interacting with them all the time and singing and narrating the day, well, I'm going to change your diaper right now. This might be a little bit cold. Hold on, we're almost done. Just talk to the baby the whole time.
Mm-hmm.
That's really the most important thing. So I want parents to relax about that part, because I don't think that they need to stress about that. There's plenty of other things to worry about.
Oh, this is true. So the moms who were chiming in were saying, well, my baby, whenever we go out, she sees someone in the street with wearing a mask, they freak out. So do you think that'll pass as soon as we get to a more normal place, even if it's months from now?
I do. I think it depends on the baby's age, right? So babies who are growing up seeing people in masks when they go out, it's going to seem kind of normal.
Yeah.
For them.
True.
So if you're out taking stroller walks and there's lots of people in masks, that shouldn't freak them out so much, really. And you can also, if you notice that that is bothering your child, let's say it's a toddler or a little bit older preschooler, then you know what? You guys can play with masks at home. So you can put masks on your stuffed animals, and you can put masks around the house around the baby, and you can decorate them around, around your child. So you can make it into games. And remember, doctors wear masks in the operating room, so that they keep you healthy, so that we can explain it in a way that it's positive and model the behavior, right? Because that's so important.
Absolutely. I love that idea of putting the masks on the stuffed animals. Oh, that's genius.
And decorating them and just having them around so they're sort of a normal thing that they see all the time.
Yeah. I mean, in their minds, it's not about bad guys with masks or anything like that. They don't even think about that.
Right. Exactly.
So we can make it fun. Love it. So speaking of that, daycare, because in daycare, if the care providers are wearing masks and a baby is only seeing the care provider all day and it's masks only, is that going to slow their development?
I think that's another good question, but I also think that since at home, their parents aren't going to be in masks around them, of course, unless they're sick or there's some other reason, I think that shouldn't be a tough transition for that same reason, especially if they start very young and then you go ahead and you go, okay, well, if they're used to it, same kind of thing. They know that their teacher wears the mask, or that their, people around them either don't wear them, and so there's a normal mix. So we're good, I think.
But we want the daycare providers to be wearing masks. And in that situation, how can we be sure that daycare is safe? And it's, of course, if you have the option, but very few parents do, to have, either to stay at home or to have a full-time nanny who's, who has been social distancing.
Right. And I've had that question at work because I do have families where both parents are required to go back to work. They have to, they're essential workers. They need to work. Then what you want to do is just make sure that the place you're having your child go is taking appropriate precautions, so that they're being safe, that the people who are taking care of your child are wearing masks, that the rooms aren't overstuffed with tons of kids running around who have runny noses and are sick, because they're not supposed to do that. So they are supposed to screen them. They are supposed to do temperature checks and ask the questions if they've been exposed to someone with COVID, if anyone around them is sick, if they have any sick symptoms or not acting like themselves. And you know, in babies, coronavirus could be some diarrhea. So you really have to ask a gamut of questions. And if you know that they clean their hands off, that they're washing hands all the time, that they're wiping down the high touch surfaces very frequently, then you know what? When you get your baby and you pick your baby up, wash hands, clean yourself, give your baby a bath right when you get home, even change their clothes and just start fresh, you know, but sometimes you have to do it. And I think the important thing is, especially little ones, they're not going to spread coronavirus to each other. It's going to be the daycare providers who are going to spread it, if anyone's going to spread it. So we want to make sure that they're wearing their masks and they're washing their hands all the time.
So you think children are not, and especially little children, I mean, they're so good at sharing germs, but in this case, they're less likely?
Yeah, and it again depends on age. So if you have a daycare that has 6-month-olds, they're not, most of them aren't crawling around except for those very athletic ones that start very early. But 3-month-old, 4, 6-month-old, they're not going to be touching each other and crawling all over each other. So that's low risk as far as them giving it to each other. It's the contact, you know. So if the daycare provider is holding your baby and feeding that baby a bottle, let's say, or feeding them food, then they need to really wash up really well before they go and help or touch another child.
Yeah, no, so true.
Yeah.
What about masks for little ones? So I've seen some images on TV of babies wearing masks, and I'm like, that's not safe. But a lot of parents are wondering about that because it's something that everybody's talking about. Put a mask on, put a mask on. So what's your take? How young is too young, and when should kids start wearing them?
So kids under 2, it's a big no-no. It's a big no-no. It's a suffocation risk. And, you know, then you have to kind of developmentally gauge kids between like 2 and even up to 8. But we would like them to keep it on. So preschoolers, you know, 3-year-olds and up, if they're used to wearing masks, and again, if you can practice and get them used to wearing it, it can become a normal thing. And you know, developmentally delayed children or children who have special needs or children who have major sensory issues, it might be a bigger ask for them. And for the same thing, you might want to slowly have to use their therapist to help you, or their behaviorist, and see if you can get it going. But there's some kids that won't, but no matter what you do. But it is overall recommended that they wear masks. Yes.
Yeah, when you're dealing with a toddler or preschooler, compliance is always an issue, right?
Yes. And impulse control. Right.
Yeah. What about preemies? A mom asked whether preemies are at greater risk for COVID-19.
It's a great question. And you know what? We don't have a lot of data, so we're kind of guessing. But what we would say is, since in general, kids under the age of 1 year, so infants, are considered to be at higher risk, then I would say yes for preemies too, and maybe a little bit more, because we know they're higher risk for other respiratory viruses. So I would say probably also higher risk, yes, but we don't have like firm data that says for sure yet.
Are they allowing parents into the NICU at this point? I know there were some hospitals, especially in New York.
Right. It depends where you are. Exactly. It really depends on the prevalence in your community and how safe it is and what symptoms, and have, you know, some places are probably having people get tested too. That's a whole other thing about how accurate that is. But, you know, some reassurance. And also, if again, let's say the parents are visiting and the hospital is able to put them in full PPE, right? So if they can put them in a gown and gloves and mask and screen them, they're probably okay. You know,
They're
if they
paying through care though.
no, I know that's going to be right.
The hard part, but you can make up for that later.
And absolutely make up for it for sure. For sure.
And what precautions should be taken? We hear this one over and over and over again by new grandparents and other family members who are visiting newborns. I know it depends a lot on where you are and where they're coming from and whether they've traveled on an airplane and been exposed, that kind of thing. But say they're local and they haven't met the new baby yet. What precautions would you say should be taken?
So, you know, and I'm going to say this and really with everything we're talking about probably too, is always good for everyone to speak with their own doctor, even for their grandparents to check with their own doctor too, about what they feel comfortable having them do based on their current health situation and your local county health department guidelines, depending on the prevalence of what's going on where you are. But in general, afterward, you know, if you know that these grandparents have not left the house, let's say they're perfectly well.
Raising both hands here.
Perfectly well, have had everything, let's say, delivered, and they're super, super careful ahead of time because they want to meet that baby. So they're staying super quarantined, and we don't want them to get it from the dad or the mom, right? So you would also, after they get home from the hospital, I would want them super quarantined for a couple weeks before I would say it's okay, because that incubation is still up to 14 days. So if you're in a hospital, you do have other people coming in, just bring your food into your room potentially, or other staff, and they do change staff. You have someone different in labor and delivery than is taking care of you in the postpartum unit. So I would say a minimum of 2 weeks, because that's your incubation period where everyone locks down for 2 weeks, and then maybe it would be okay. Still, they should wear masks. Everyone should wear masks. Anyone new coming into your home.
And of course, we have to make sure they had their Tdap.
Yes. And during flu season, a flu vaccine.
Flu vaccine, yeah. We can't forget about that. And, you know, we're all concerned about COVID-19, but we have to always be concerned about the other vaccinations being up to date.
Yes.
For everyone goes near that precious bundle. So should they be tested for COVID-19, the family members, before they come to visit, or we can't just the test?
I think it's not as good as a quarantine for 2 weeks and then maybe test near the end of that.
Yeah.
Because if you test and then you could be incubating it and maybe not test positive for 2 more days, or have symptoms for a few more days, and you'll miss that. There's a window, and it's a tricky window. 14 days is a long time. So if you test on day 5 from maybe when you were outdoors, you might be negative, but on day 8, you could be positive. And I read something today, a couple of doctors and I were talking about how day 8 after being potentially exposed is like sort of a better time to do your testing, actually.
Okay, that's good to know. No matter your age.
Right. Yeah. And we still don't want a lot of visitors for the newborn. So I'm just talking grandparents. I'm not talking about aunts and uncles and cousins and people coming. No. I lock you down anyway after you have your baby. I am like, you are quarantined anyway. So
it's a silver lining, actually, that you have to be quarantined and that you get to be with your baby and do some, you know, mom, dad, baby bonding without a lot of visitors. And visitors you have to clean up after. Like, who's that? Not me.
And especially now, you really have to clean up. So
no, seriously. What about play dates? A lot of kids are missing their play dates, and a lot of parents are missing the play dates because, you know, they've been the only playmate for 4 months now?
A long time.
And it's definitely a long time. So if parents are thinking about play dates, how many children should be involved, and where should the play date happen?
So risk level, again, with everything we're doing, you're assessing the risk level. There's things that are lower risk, medium, and high. So that's in the medium, but it could be high depending on how many people are there. So density is really important. The more there, the higher risk of spread. And if you're indoor, much higher risk of potential spread. So if you, and I get this question about Playdates, we're getting this constantly in all kinds of scenarios. And if you can, it's almost like when we talk about a quarantine pod, it's still the same kind of thing. If you know that you have, I would say, one or two other families, because that's hard enough to control who they're seeing and where they're going. So if you know they have the same philosophy about this as you, and they're worried at your level, and they wear masks when they go out, and they're not going to restaurants, or they're not riding on airplanes, then you have to screen them and go, okay, they're similar to us. We're all going to tell each other if we have some accidental potential exposure, so that we're all honest. We're not going to have other sneaky play dates that this group doesn't know about. You have to trust these people when you're doing this, and it should be outside, and we want to encourage the mask wearing. I mean, if the kids are running around like crazy and they don't keep it on and they're outdoors, I'm not so worried, but I want the parents having the masks on, and I want the parents to social distance at the play date.
Yeah, that's true. But what about the playground equipment?
That can be concerning. I'm not so comfortable with playground equipment right now. You know, I mean, I think that if it's an empty park and it's first thing in the morning, if no one else has been there, you could wipe it down and maybe have some okay playtime outside.
But otherwise,
I'd be worried if it's a park that has a high traffic park with a lot of people. I'd be much more concerned about that.
it's better to kick around a soccer ball.
Yes. Yeah.
And kick it around, not throw it, because you're touching with your hands.
Exactly. Kicking it around is, tennis is not bad.
Okay.
Swimming, I think, is pretty okay, as long as, again, it's not like a whole bunch of kids. It's still that maybe a couple, and it, depending on their level of ability, if they're able to stay apart and let's do flips and somersaults and, you know, laps or whatever, where they cannot be smushed together and spitting and coughing on each other, you know, because there's that.
Which is almost inevitable, but yeah.
But at least it's in the water. There is a dilution factor.
And what about, does that go for public pools as well? Or you want to just stay in pools that have a very controlled environment?
Public pool, it's going to be more dense, you know, especially now. Most places are, at least in the US, it's pretty warmer. And so it's going to be too hard to control the density of the people there. So that would make me concerned. Because you don't know where they've been and what they're doing.
No. So this mom says she has a 3-year-old who was diagnosed with asthma and prescribed controlled meds. Would it be, would this child be at higher risk to go back to preschool?
Right. So still, you know, there are people that will say, oh, asthma is a risk factor. Much more so in adults, though. Kids, it hasn't panned out to be, but, you know, in general, we here haven't had tons of schools open yet.
Yeah.
So we haven't had as much exposure for us to really know, but from other countries, and so far what we've got from information and even from here is that those kids still tend to do okay. Not as bad as you would expect. So it's not as bad. Yeah. So I think, and also if they're on a controller medicine, then that's going to help also to keep the inflammation down and prevent a problem too, if they're good about being compliant with the medication.
That's reassuring. Now, of course, there are lots of reasons why little ones get runny noses. And one mom was wondering how you can tell the difference between COVID-19 symptoms and, for instance, RSV.
Okay. That's a great question too. So RSV is an upper respiratory virus, but can be a lower respiratory tract virus too, especially those with asthma. That's one that can affect them more. Premature babies, it can affect them more. And it can, but in some people it's just a cold. And I find when the parents get it, they get a cold. And a lot of times they start with a laryngitis. So it's going to look like COVID. Like to us, any illness right now is COVID till proven otherwise. They can look exactly the same. So you cannot tell the difference without a test. And if you do a test and you're really still suspicious, then it may be worth retesting several days later to confirm, because the tests are maybe 80% accurate, some more, some less.
Yeah.
The tests right now. they're still working on getting the best tests out there. But
with a false negative being more common than a false positive?
Yep. Yes.
Just
exactly.
like
I know.
So, what do COVID symptoms look like in babies? And you mentioned diarrhea. What about the trademark cough of COVID? Is that, or really nothing's a trademark because the symptoms seem so varied.
Right. Especially in kids.
Yeah.
You can have like the slightest cold where they're like eating and sleeping and playing and don't even act sick, but they have a runny nose, like when we've seen with a million other colds.
Yep.
It can be that. And it can only last maybe 4 days, whereas adults have it for like 6 weeks and they're so sick. So it could be, yes, a cough, you know, maybe up to, you know, 70% may have a cough at some point, but they may not have that the first days or week. But yes, diarrhea for sure, vomiting, fever, plus minus, maybe, they're all maybe, runny nose, cough, sore throat. You can get rashes too, like viral rashes also.
But it's always hard to tell whether a baby has a sore throat. Unless it's a symptom that you can see yourself and tell you about it.
Yes.
You can't say their tummy hurts, their head hurts.
Yep. And they may be not wanting to swallow, but yet seem very hungry. I have some parents who are like, I can tell he's really hungry, but he like sucks once and pushes it away and cries. That might be your way of telling that maybe the baby's throat hurts.
Babies are tough customers when it comes to diagnosis sometimes.
You got to look at the whole big picture and ask a lot of questions.
The whole big little picture.
Yeah.
So one mom said she and her husband are essential workers. I don't know if they're healthcare professionals, but how do they keep their 7-week-old baby safe?
So, you know, that came up a lot, even with like physicians that were working in, some of them when they were working in the height of it in places like ICUs where they were seeing a lot of it, they weren't going home at all. Or if it was one of them that was in a higher risk, the super risky one would stay someplace else or Airbnb or go in and change it and sneak in the house in a different way and stay in one area. But if they're not, let's say, working with COVID, but it's more the general public, then what they have to do is, of course, always wash their hands, always wear their masks. And if they feel at all sick, they need to even try to quarantine, even if it's in their own home, and stay away from others the best that they can. But they should strip down when they get home and change clothes too, shower, get all freshened up.
Wash your hair.
Wash your hair. Yes, exactly. Anything you can to just clean yourself off from your day is really important. And you know what, if you may even wear a mask in the house, depending what your job is and the type of people you're around, so that you don't transmit something. At least if it's, let's say, you know that you were at a more crowded place and you can avoid something and it's what you do, maybe for 2 weeks, you wear a mask. So you have to think about what would be the safest way to prevent, you know, or maybe one parent has a less contact job than the other. So maybe that's the main caretaker of the child.
Right.
You know?
Especially when it comes to things like feeding.
Yep. Way up close.
Oh boy. So another mom is asking, she's pregnant and wondering when she needs to find a pediatrician, which is not necessarily COVID related, but perhaps more so a concern than ever before, because we want to make sure we secure our pediatricians ahead of time. When do you typically start seeing, or I imagine it's through televisits at the moment, video visits, so when you do consultations with new parents, how many weeks of pregnancy are they usually at?
You know, most of them are like third trimester most of the time. You know, some get an early start. We've had people come in they used to come in, call now and do either a phone consult or a video visit, and they're due in December. There was one recently. That was just exciting. Fine. We have anytime they want, really. There's certainly no downside to checking it out early, but I'd say most do it at later on. But don't do it like, well, I'm due in 2 weeks. That's a little late.
That's a little late, especially if you might birth early.
I think around the 30, early 30 weeks is good, late 20s even. You know? But that way you'll have time to maybe fit in a few if you know, or if there's a few that you want to talk to.
Or they'll just go to you first because you're a keeper. So now all of America is going to be calling you. Just be prepared, okay? So what about babies, if their moms test positive during pregnancy? Do we have enough data to know whether that could affect a developing fetus, or is it still too early in the game?
It is early. There is data from China. There weren't that many. We have a little bit of data here, but so far the babies have been okay. So for me, I'm more concerned with, is the baby going to get it from that mom if she still maybe has it at delivery? So that's a whole other thing. But the baby itself having some type of a congenital syndrome infection, that so far has not shown to be the case.
We don't know yet also whether they are born with antibodies, if their moms developed antibodies. Don't know yet.
Don't know yet what those mean too. Do they mean anything? Do they just fade away? Because now we're even finding in the adult population that the antibodies at weeks to months often disappear. And someone who was confirmed for sure had it and even had antibodies and now doesn't have antibodies. So that's a whole other thing about what those mean, right? I know.
We have to learn. And we have to learn it in the trenches. There's no substitute for that. We can't even speculate that well. And now, of course, I mentioned this earlier, but it's such an important reminder. And I would love for you to remind parents why it's so important to keep up not only with the well baby visits and the well child visits, but with vaccinations. I'm still hearing from moms who are reluctant to take their babies or their children in for visits. And sometimes, in all fairness, the visits are being canceled or postponed because doctors are taking so many precautions. And I know some pediatric offices are more accommodating than others, but just remind us why it's so important.
So, I mean, if you know, and what we're doing is we're only doing well checks right now. So we're on purpose trying to keep the office as clean and safe as possible. And that way we can do this important task of making sure that the kids are growing, are developing, are up to date on those vaccines. Because the last thing you want to do is have a lapse in all these vaccines. And then on top of COVID, we have measles, or we have a lot of whooping cough. Now that's a respiratory infection that's nasty and you can cough for months. I mean, you definitely would want to avoid that and COVID at the same time.
Yeah, and also because babies are more vulnerable and toddlers are more vulnerable to that as well as to flu.
Yes, exactly. And that as well. So you have a whole bunch of things that you can prevent. Though you may not be able to really prevent COVID, you can certainly mitigate other illnesses in your child, so you have a little bit less to worry about. Plus, the other reason, a lot of the stuff that we've been talking about at the checkup has been the social emotional piece of how they've been doing since this started. And there are some that have really done okay, and their parents have them on a schedule and it seems to work for them, and the families are getting fit together and they're really trying to, you know, make it a positive. And there are some kids that are playing, you know, video games for 4 to 6 hours a day. They're not getting outside and they're snacking. They're at the pantry eating just junk all day long. So that's where we can step in and go, okay, guys, let's reboot here and start fresh. And here's your weight now. Here's your height now. Here's what's ideal. Here's why. And let's go back to our fruits, our vegetables, our proteins, our whole grains, and our water and our no sugary drinks, and at least an hour a day of outside activity. So sometimes they need that reminder, because when it's always the parent telling them, it's deaf ears, blah, 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 you know. So
no, for sure.
Someone else is actually saying, this is for your best interest. This is for your health. Yeah. This really matters, and it does make a difference.
Yeah, I was reading an article about emotional eating and how it was impacting school-age children, you know, in particular, but it can impact toddlers as well. If there's nothing else to do in the house except snack and play video games, well, we all know what's going to happen. What would be your, I know we're dealing with the real world, but what would be your realistic recommendation for screen time? Are we being a little more relaxed than we were pre-COVID, or by a little bit, not so much?
We are more relaxed. I think it's just had to be that way. But I think it's like the overall issue of when kids do too much screen time, it replaces other healthy activities and socialization with actual people, even if it's your own family, right? You want to actually talk to your kid and have your kid interact with you. And I'm always reminding people, just do chores, make the market list together. They have their assignments, they help cook, they have to fold the laundry and take the trash out, and they have to have their brain time, where it's a reading time, it's puzzles, it's games, it's things that get you moving outside. So you have to have more of a balance, so it's not so screen heavy. So if normally we would say less than 2 hours a day, some of the kids right now might have 1 or an hour in the morning and then watch a movie in the afternoon. So it may be a little bit more, but I don't want to see every single day 4 hours or more. No. Still trying to max it at 2 is a good goal, but some days are higher, then pull back after. And also to not do it in the evenings. Your kid's going to have more trouble sleeping, no matter what they watch, even if it's not a scary or a violent show, which they shouldn't be watching, but sometimes they're watching what siblings are watching, and we try to avoid that. But at late at night, it can really affect their sleep even more, especially 1 or 2 hours before.
Yeah, and they might fall asleep but not stay asleep and start having issues in the middle of the night. So that's not for all of us, by the way.
Yes, and it's not good for anyone's health, right? Because one of the best immune system boosters is getting your sleep.
Yeah.
People always ask, what should I take? Do I need more C now? Should I take more vitamin D now? Well, a good balanced diet. But I do have some patients I have on D because we've drawn blood and I've seen their vitamin D levels a little low. So I may advise them to take 1,000 units IU of vitamin D3 every day. So there's no downside for my teenagers and the parents to do that kind of thing. But still, the best immune system booster is sleep, healthy eating, exercise, hydration.
And I guess if they're not getting enough vitamin D, they're probably not going outside as much as they normally do. So good reason to go kick that ball out there.
Right. It's so true. Walks and family hikes and bike riding, those are all good things.
Yes, well, you can. Yeah, enjoy that summer. So I just want to thank you so much for answering all of our questions. And I know you'll be back because there's one thing we never run out of. It's questions, right?
Yeah. Questions and babies.
And babies, yeah. I never want to run out of those, but I do want to snuggle some. So I really hope this is over soon. You don't even get to snuggle them as you used to. Aww.
It's true. It's not quite good.
It's hard. Okay, well, lots of hugs to you virtually.
Too.
And we'll talk soon.
Okay, thank you for having me. Take care.
Thanks, Dr. Crosby. Bye.
Bye.